The welcome. Good evening, everyone. My name is Stephanie Winters, and I'm here tonight on behalf of the American Academy of Pediatrics Vermont chapter. And we really wanted to hold these forums to provide factual information on the COVID-19 vaccine for adolescents and have a conversation with families. So please ask any questions by typing them in the chat box, and we'll read them during the question and answer period. On behalf of pediatricians, I can say that they feel privileged to be a trusted source of information around vaccination, and the COVID-19 vaccine is no different. Protecting children and adolescents from vaccine-preventable illnesses is a top priority for pediatricians, and they're ready and willing to counsel families on this important decision. With that, I will introduce 3 local pediatricians that will be with us tonight to present and answer questions. Dr. Anna Hankins and Dr. Carolyn Lorenz Greenberg are from the CVMC Pediatric Primary Care, and Dr. Ashley Miller is from South Royalton Health Center. So I welcome you all. I thank you for being with us tonight, and I believe, Dr. Hankins, I will turn it over to you to start the presentation.
Thank you so much, Stephanie. I am so excited to be able to say that we are here to talk about vaccinating our children against COVID. I think that a year ago, none of us thought that we would be here tonight this quickly and with so much good stuff to talk about. So we're going to give you all tonight a brief overview of how COVID has affected children, particularly in Vermont. And how it has affected children in Vermont from a mental health perspective. And I know that Dr. Lorenz Greenberg and Dr. Miller have shared my experience of just how serious this has been for our children and adolescents. We're going to show you a brief video from our American Academy of Pediatrics Vermont chapter president, Dr. Rebecca Bell. And provide some more information about the COVID-19 vaccine that's being given to children and adolescents. And then we want to leave a lot of time for your questions. So go ahead and use the chat the way Stephanie said. And let's see, I'm going to have Stephanie go to the next slide. So here's the situation in Vermont of cases of COVID by age group. So you all can see that highest bar shows that those 20-somethings in our state have had the most cases of COVID, almost 5,000 total. All of the grown-ups have had similar thousands of cases. And then when you look to the left of the graph, our teenagers had a total of almost 3,600 cases, and our 0 to 9-year-olds had 1,700 cases. And on the right, it's broken down by gender, ethnicity, and race. So here are the rates, and I'm going to have Stephanie go right back. We had a really slick plan for a signal for next, and it's not working. So go forward 1 slide, Stephanie, and thank you all for putting up with us. This is a different way of looking at the data. These orange bars that you're seeing are the number of cases by week in our school-aged kids. So you all can see that week in early April that we had almost 300 cases in children. And then the gray bar is our non-school-aged people. Next slide, please. So here are rates per 10,000 by week by age. So that green line is our high schoolers. The purple line is middle schoolers, 11 to 13-year-olds. And then the blue line is elementary schoolers, the 5 to 10-year-olds. And so we can see that we had the highest rate of 9 cases per 10,000 per week in our high schoolers, but our middle schoolers and elementary schoolers were not far behind. Next slide, please. And as I was preparing for this presentation, I was really touched reading this. These are youth voices talking about the effect of this pandemic on our kids. And I've been experiencing these effects every day in my office as I see young kids and medium-sized kids and teenagers all really struggling and also really showing resilience. So in the top section, you can see we have Zoom, we have Google Meet, we have FaceTime, and we don't have a true connection. I know I see that in my own teenage children when they're on their remote week and they're still connected to school through their video visits or their video classes, and their moods just kind of decline over the week because of that lack of good social connection. Children are feeling guilty, relieved, terrified, and they want to go back to just being kids. Next slide. So we're going to play this video that'll last about 10 minutes.
Hi there, I'm Becca Bell. I'm a pediatrician in Burlington and the current president of the Vermont chapter of the American Academy of Pediatrics. And I'm just going to take a few moments to talk about how excited we are as pediatricians that the COVID-19 vaccine is available for young people now. So I'm a pediatric intensivist, which means I take care of children in the pediatric intensive care unit at UVM Children's Hospital. And I take care of infants, children, and adolescents who are critically ill or injured.
Stephanie, let me know if you'd like me to go on with the presentation, and then we can try to go back to this video once we have it working.
I can also try and share my screen with the video if that helps, Anna.
Yeah, I guess I should have asked, is everyone else having trouble seeing the video?
Yeah.
Yeah, okay, good. I'm glad I didn't just interrupt it because I was the only one. Ashley, why don't you try sharing?
Yeah,
And so
I think Ashley should.
vaccines are something that
I'm worried that this is Brina. I think stuff sometimes has internet issues, like all of us.
Mm-hmm.
Go ahead,
So
Ashley.
are you able to
share?
Yeah, you have to be granted permission, though, right? All right, let's. Oh, there's Steph. She's back. She's not back.
Am I back?
Yes. We're going to skip the
apologize.
video, we think. Yeah, maybe try to do it on. Ashley and I will figure out a way on the side. I'm going to text you an idea, Ashley. Oh, there. Maybe we'll just use yours.
Can you see my screen now?
Yeah.
All right, now I just need to be smart enough to present. Slideshow, current slide, play.
No audio.
No audio.
I think when you hit share, you have to hit the little box on the left-hand bottom that says share with sound. We're all learning new things every day.
The COVID-19 vaccine is available for young people now. So I'm a pediatric intensivist, which means I take care of children in the pediatric intensive care unit at UVM Children's Hospital. And I take care of infants, children, and adolescents who are critically ill or injured. And so vaccines are something that have always been really important to me because they help prevent a lot of the very serious illness I sometimes see in the ICU when children are too young or haven't been vaccinated against a vaccine preventable infection. And when I think back to last spring when everything was shutting down and I was working with some of my other ICU colleagues who care for adults, and we were really worried about the number of ventilators and the number of hospital beds. If you had told me then a year ago that we would have a number of safe and effective vaccines that in trials when tested on tens of thousands of people prevented people from not just dying, but even becoming seriously ill enough to even be in the hospital, I don't know if I would have believed it. It's amazing how effective these vaccines are. And a lot of people are wondering, how were we able to get these vaccines so quickly? It seems like quite a feat. And, you know, in pediatrics, we're used to vaccines taking a little bit longer. And part of that is that there's a lot of competing interests in terms of what type of research and technology gets funded, right? Lots of competing interests there. And when we test vaccines on other types of infections, usually those infections aren't as common, aren't as prevalent. And so it takes a while to get all that data. But with COVID-19, as we all know, the world stopped last spring, just completely stopped. And the biggest priority that everyone had in the world was stopping this virus. And what that meant really was having safe and effective vaccines. That became the top priority. And so every effort was turned towards that. All this funding was turned towards that. And a ton of collaboration happened in order to make this possible. So I want to talk a little bit about the vaccines that you all qualify for, are eligible for, or will be soon, and that's the messenger RNA vaccine. So that's the Pfizer and Moderna vaccines. So this is a technology that's been in use in cancer therapies, and also scientists have been using it to study vaccines for other infections. And so when the world was told what the SARS-CoV-2 virus looked like, that was something that was shared with everyone, people got to work. And so they used this technology that already existed, and they made it applicable to the SARS-CoV-2 virus. And because there was so much funding going towards this, they were able to make this happen on a little bit of a quicker timeline than usual, but all the steps were there. They went through every single step. And because COVID-19 is so prevalent, when they did the efficacy trials to see if it worked, and they gave vaccine to some people and a placebo to other people, they saw very quickly that the people who received the vaccine weren't getting sick from COVID-19. And the people who didn't receive it were getting sick. And that data was collected so quickly that they were able to get a pretty definitive answer that these vaccines are really effective. And one thing that I think is so interesting about the mRNA vaccine is that it really gives your body instructions for how to make a protein that looks like what's on the virus. So what do I mean by that? So when you get the vaccine, this mRNA is like a little piece of instruction, or I almost think about it like a handwritten recipe that's sort of passed down in your family, right? You have a piece of paper with a recipe, and then these are instructions. And your cells can make, based on the instructions, can make a spike protein with that. Then once it's made, recipe goes away, and the mRNA, it just kind of disintegrates and disappears. And then what you have is this harmless spike protein that's not the virus, but is similar enough that your immune system can look at it, recognize it, and get ready for it in case they ever see the SARS-CoV-2 virus. And this is really important because this is what will stop the virus from replicating throughout your body if you're exposed to SARS-CoV-2 and making you very sick. And one of the things we know in intensive care medicine is that these viruses, SARS-CoV-2 in particular, the virus itself can cause a problem in your body. It can cause direct injury and illness. But the other problem is on the other end, when your immune system is trying to fight off that virus, that battle that happens can create a ton of inflammation and a lot of problems and a lot of illness. So it's that back and forth between it's the virus and your immune system. When you get exposed to the virus, when you get sick, that can make you really sick. Now, in someone who's been vaccinated, instead, their body sees the virus and their immune system's already ready. They already have the antibodies. They recognize it really quickly before the virus can kind of get out of hand. And they've got the cells ready that they know they need to fight off this virus. And that's why people aren't getting very sick. They're not dying. And if anything, they might have a mild cold after being vaccinated. And that is what's so amazing, is that these vaccines give your cells this recipe for how to create this spike protein. Your body then, your immune system then learns it, understands it, recognizes it, and gets ready for it. So when the first authorization happened, first with Pfizer in December, I was one of the lucky ones to get vaccinated pretty early. And as you can imagine, there were lines of doctors and nurses and other healthcare providers who were just so excited to get this vaccine. I mean, it was emotional. I felt emotional getting the vaccine for the first time, knowing that I was protecting my body. And then I got my second shot in January and had the expected, many people kind of feel crummy the next day because they have that, they can sense their immune system sort of recognizing again this spike protein and sort of revving up for it. And then fine after a day, felt fine after a day. And it's just been so amazing seeing my rest of my family and my friends and my colleagues and everyone I love getting vaccinated. My own children are too young right now. They don't qualify, but I'm going to be so relieved and so grateful when the vaccines are approved for their age group, and they will be first in line. So I just wanted to spend a moment just to really let everyone know that, you know, we're living in this really, really challenging time. This virus has really wreaked havoc directly and indirectly, and it's affected all of us. But there is this really bright spot, and that is these vaccines they're really effective, and they're really doing what we want them to do, which is to keep us from getting sick. And we really want you to ask questions. If you have questions about the vaccine, we're here for you. Pediatricians are really excited that the people we love, our patients, are going to get vaccinated soon. And we're happy to walk you and your family through this process and work towards getting our communities healthy and getting back to doing all the stuff that we love doing. So thank you so much for listening, and please feel free to reach out to your pediatrician and reach out to us, and we're happy to work with you on this. Take care.
All right. Let's see, Ashley, do you want to go ahead and keep running the slides, or Stephanie, do you want to jump it back in? There's just a few more.
I will jump back in and we'll try this again.
Thanks, Stephanie.
Yeah, sorry about that. I live in central Vermont where our internet is lacking in most places.
I loved hearing Dr. Bell talk about her personal experience getting vaccinated because it was so like ours. I remember when Carolyn and I were in the office after we had gotten our second dose, and we were both feeling a little bit crummy, and we both went, "Yes, it's working!" And it was like a party. We were so excited. All right, here we go. Well, I think your slides will show up in just a minute. So I'll just talk while I'm waiting for your slides. So we're going to talk a little bit about the specific COVID-19 vaccines. And oh, here we go. We've got the slides, so I'll follow them. So I think this is a great poster. I feel like I should hang it up on my teenagers' doors because both of my teenage boys got their second vaccine today, and they're so excited. So I feel like I should print this and hang it up. But 5 reasons that teens should get the COVID vaccine. 1, they get exposed and they don't need to quarantine. 2, freedom. 3, see your friends worry-free. 4, able to socialize, travel, and play sports. And 5, life more like normal. And I think from a mental health standpoint, our teenagers really need this. Next slide, please. So we know that as parents, you all have lots of questions about the vaccines. The one that we're going to be talking about tonight mainly is Pfizer, which is one of the 2 mRNA vaccines that Dr. Bell talked about, and it was authorized in December for teenagers ages 16 and up, and has now been recommended for use in the 12 and ups. Next slide, please. So the COVID-19 vaccine works similarly to other vaccines that your child has received in that it teaches the body's immune system to make antibodies to fight the virus. So after your child gets vaccinated, your child has less of a chance of getting COVID-19. And if they do get infected with the virus after being vaccinated, their likelihood of being sick enough to be in the hospital or to die is a lot lower than if they weren't vaccinated. Next slide, please. So there are 3 different vaccines that have been authorized by the FDA so far. Pfizer and Moderna are the mRNA vaccines and require 2 doses. And Pfizer is the only one that's currently authorized for our adolescent patients. And then there's one vaccine made by Johnson & Johnson that's a single dose rather than 2 doses, and it is not yet authorized for teenagers. Next slide, please. So the Johnson & Johnson vaccine, I'm sure all of you heard that there was a temporary pause during in the authorization for this vaccine because of reports of blood clots in a small number of patients. I was so impressed with our system when I saw that happen because it showed how carefully these vaccines have been being monitored for safety. And when there was the smallest number of cases of something very serious, there was an immediate pause and whole groups looking into it to make sure that things were okay before things restarted. Next slide, please. So research shows that all of these vaccines are highly effective at stopping people from getting COVID-19, at preventing serious illness, hospitalization, and death in people who do get sick. We don't yet know how long immunity will last, and that's going to take time to figure out. So as we go forward, things will get more clear on how long immunity will last. Next slide, please. So all 3 of the vaccines are safe and similarly effective. They weren't studied against each other. I've watched people talk about, well, this one's 85% effective and this one's 95% effective, but each of the trials were different and in different places, in places with different rates of disease at the time, different numbers of variants. And so without a head-to-head trial, we really can't be doing that kind of comparison, but we do know that they're all safe and effective. And we also know that they have similar side effects. And you heard me saying that my friends and I were excited when we had side effects because it shows that our immune system's working. So it's a good thing. Next slide, please. So the vaccines are remarkably safe and effective for adults and for youth ages 12 and up. And these trials involved a remarkable number of people. So tens of thousands of volunteers took part in the trials. And even though these vaccines got rolled out very quickly, they still went through the same phase 1, phase 2, phase 3 trials that would happen with any vaccine rollout, and in fact with larger numbers of participants. It's just that there were so many resources being put into this that the phases of the trials were able to go through very quickly. And ongoing, the vaccines are monitored very closely. The CDC is saying that COVID-19 vaccines will have the most intensive safety monitoring in US history. We saw that with the Johnson & Johnson vaccine. The moment there was a concern, there was a pause and a review of the data. Next slide, please. So some people don't have any side effects at all from the vaccines. The most common side effects are fever, chills, headache, fatigue, nausea, and muscle aches. They're temporary and they go away within a few days. Next slide. It takes about 2 weeks after getting your second dose to build up immunity to the virus, and 2 to 4 weeks after the dose of the single dose vaccine, the Johnson & Johnson. And these vaccines are free to anybody, no matter whether or not you have health insurance. Next slide, please. So for Vermonters under age 16, we're now able to vaccinate our younger adolescents down to age 12. And there are clinical trials going on for the youngers. So I'm hopeful that my 9-year-old will be able to be vaccinated soon, and all the way down to 6-month-olds. Next slide, please. So it is okay to get other vaccines around the same time as the COVID vaccine. So it's really important during this pandemic that our kids stay immune to measles, and that we don't have an upswing in other really scary diseases while we're just focusing on COVID. And so given the importance of continuing routine vaccination and the need for quickly rolling out COVID vaccines, if a child or an adolescent is behind in vaccines or due for vaccines or at increased risk for certain vaccine preventable diseases, we can give these vaccines at the same time. Always, when you have concerns or questions, call your pediatrician and let us help you figure this out. Next slide, please. So this just shows all the different ways that you can get registered for the COVID vaccine. I just Google Vermont COVID vaccine and it gets me to a place that helps me out. But you can get it through Kinney Drugs, Walgreens, CVS, through the Vermont Department of Health. And on the next slide, we're going to see school clinics giving vaccines. Next slide, please. So you can register online to get your vaccine dose through a school clinic or through another community clinic. And if you can't figure out the online sign up, you can register using the call center. I've had to call the call center a couple of times for various reasons, and they are just on the ball and helpful. So it works well either way. Next slide, please. Some of the clinics may have some limited walk-in vaccine doses, and parents do need to provide consent. Schools are going to be given a permission form that parents and guardians can use to give consent, and those permission forms will be translated into multiple languages. If a student shows up at a clinic as a walk-in and doesn't have a parent or guardian to consent, the clinic registration staff will be able to call the parent and get consent over the phone. The best way to guarantee that your child is going to get a dose is to register in advance. Next slide, please. And then here, when you see the slides later on, this is just some great links for more information. And I'm going to give a shout out to the middle link for healthychildren.org. That's not just for COVID, that's for everything that you ever wanted to know about parenting and children's illnesses. And I go to it for figuring things out with my own children. So. And with that, I think I'll ask Stephanie to stop screen sharing, and I'm going to turn the conversation over to my colleagues so that we can start answering some of your questions.
Great. Thank you so much, and thank you for bearing with me with my internet issues. So I do have some questions that have come in, so we'll start that out, but I do encourage people to type their questions into the chat box and I will read them. The first question is, what about the long-term studies that are regularly required before releasing vaccines to the public? Could you speak about other long-term studies, if any, with mRNA vaccines, or what the long-term risks might be specifically for children?
Carolyn, you want to go ahead and take that
which
one?
of us wants to go? So in terms of the long-term studies, I mean, obviously this vaccine has not been around for a particularly long period of time because we've only had this virus in our lives for 14-ish months at this point in time. As we've already talked over, I think during the presentation, it was very well studied during the time period of both vaccine development and the initial rollout studies were in fact very similar to what is usually done prior to vaccine rollout. But in part because of running some things in parallel, and in part because we're in the middle of a pandemic, so the number of cases and exposures were high enough that it was pretty easy to get to a visible difference between control groups and test groups more quickly than you would with an illness that's far less common. It was able to be done more quickly. Now, in terms of long-term follow-up, it's currently under an emergency authorization, and the emergency authorization isn't a permanent full authorization. The FDA is actually continuing to do the same evaluation that they would for any vaccine. The expectation is that under an emergency authorization, a company will continue to collect data and will continue to put together a full presentation, which will eventually be put through to the FDA. And my understanding is that Pfizer is working on their final authorization for the adult vaccine now, and I would assume that the adolescent rollouts will be added on as the data percolates in as well. So it isn't that the long-term final authorization isn't going to happen, even though this happened under an emergency authorization.
And the other piece is that the mRNA technology that we're using, even though we haven't used it for this COVID vaccine before, they've been studying it and looking at it for other types of the coronavirus. And as Anna had said, also in cancer trials. So we know long-term what to expect in other types of mRNA vaccines, and we have no reason to think that this vaccine would be any different, both from other mRNA uses and also other vaccines like the flu vaccine that we've been using for a very long time now. So we're quite comfortable as physicians using this vaccine on ourselves, our own children, and for our patients to help prevent this pandemic from continuing to spread.
You know, I was anxious about this before I got my vaccine. I was worried about it. And the thing that really helped me kind of put it in context was absolutely, it would be great to have a vaccine that we had given to people 100 years ago and had watched them their whole lives to make sure there were no long-term side effects. But we know there are long-term consequences of COVID infection. So it's sort of vaccine, which really theoretically should not have long-term side effects or problems when you look at the data and when you look at the science underlying the vaccine, versus really scary virus that kills people and causes long-term bad side effects.
Mm-hmm.
And that was what made me sort of dance into the clinic.
Great, thank you so much. if your child is in between doses for another vaccine, for example, Gardasil dose 1 and 2, is it safe to get the Pfizer vaccine if it has been more than 2 weeks? How long should you wait after Pfizer dose 2 to receive a second dose of the other vaccine?
So we're really lucky again that we have so many studies of other vaccines being given at the same time in these teenagers and our preteens. So we know what to expect with those. At the beginning, out of an abundance of caution, they recommended that adults space their vaccine 2 weeks from any other vaccine. That's no longer recommended. That did just change over the last week or so. That really, again, it's more important to keep everyone safe. We expect these vaccines will be fine together. You can give them on the same day. They just recommend giving them in opposite arms, and that you could give them within 2 days of each other, within a day of each other. It doesn't matter anymore, which is really great. Again, science keeps changing because we keep learning more, so we can keep doing better.
Great. What about the blood clots caused by the AstraZeneca vaccine?
Carolyn, you want to go ahead?
Well, so at this point in time, as you know, the AstraZeneca and the Johnson & Johnson vaccines, which are both kind of a different modality of providing the information about the spike protein to the body. Those are adenoviral vector vaccines. And so they work in a different sort of way than the mRNA vaccine that we've gone into. Neither one of those are approved currently for use in adolescents. And so that they aren't options for your 12 to 17-year-olds at this point in time. And blood clots have not been something that's been identified as a risk with the Pfizer and the Moderna vaccines, the Pfizer in particular, which is the one that is currently available for our adolescent population.
Great. Those are the end of the questions that I have listed. If other people have questions, please feel free to type them in the chat or unmute yourself. We're an informal group, so would love to hear from people if you want to unmute yourself and ask questions. While people ponder and think of that, are there any closing thoughts that any of you would like to add on that weren't covered in the slides?
I guess one of the things I wanted to say, and I think Anna did touch on this, we're here to help. We're your pediatricians. We want to do whatever we can to make you feel comfortable, to help connect you with vaccine, to get you transportation to the vaccine, whatever you need, please reach out to our offices, because we do feel really strongly that this is the best way to protect our children and all of us here in Vermont. So please don't hesitate to reach out at all.
I think it comes down to, again, what Anna was saying about the balance between, the kind of risk of a vaccine, which we believe to be safe based on the data that we have, which has been given to millions of Americans at this point in time and has been monitored very closely after giving it. I mean, we all participated in this post-vaccination V-Safe information where we essentially input our information. They checked in with us frequently for quite a period of time. Basically, all of us who were early adopters got that as part of it. And so they've been keeping an eye on us all after getting the vaccination. And that's the kind of information and feedback that led to the concerns about the blood clots with the Johnson & Johnson vaccine. That's how that was identified. So I would say that we have to compare the risks attached to a vaccine, which again, we all think are very small, with the very real risks of this pandemic that we're seeing, of getting COVID, of the effects that we're seeing on people, the potential for cardiac effects, the potential for neurological and psychiatric effects afterwards that are being identified. I think all of us feel very relieved to have a safe and effective vaccine so that we can reduce that risk for ourselves, for our families. I'll say that as a parent of a 13-year-old and a 9 and 11-year-old, I was delighted to sign my 13-year-old up for getting his first vaccine the day after it was available. He got his on Thursday, and he was over the top excited about it too, and has done great with it. I can't wait till I can get one for my 9 and 11-year-old. They'll be first on the list too when I can have a choice.
That's great. And we did have another question come in. Could you tell us when the Pfizer study began in 12 to 15-year-olds? Was it in January?
So they began with the Pfizer study. They started enrolling actually very shortly after the EUA went through for the adults. So it was actually at the end of last year. And I know because I tried to get my 13-year-old enrolled in the trial, but the study sites were all too far away. Ditto for my 9 and 11-year-olds. I've been trying to get them into trials too, because I would frankly love to get this vaccine into them sooner if I had any way to do it. So I tried signing all 3 of mine up, but the nearest sites are in someplace in upstate New York, and there was another one in Boston, but those are the closest ones. So if you're in Vermont, you're kind of out of luck for that. But yes, it was November, late November, early December was at least when I was trying to enroll him.
Great.
Carolyn, I knew you would know the answer to that question.
That's great. Well, Dr. Hankins, did you have any final thoughts for us?
I'm just overjoyed. I think this is such a gift for our kids. It's been such a hard almost year and a half, and we're to see Vermont rates of vaccination up over 50%, up over 60%, approaching 70%, and now adding in the youngers. I feel like every day should be a party.
Yeah, when my son left his class to go get his vaccine on Thursday, the whole class applauded when he told them where they were going. I mean, that's how they feel about this.
That's sweet. Another question came in, and this question has come up in other forums, and so I think it is important to talk about if people have questions about this. Does this vaccine have any effect on youth or young females that have yet to start their menstrual cycle?
It's actually a really interesting discussion just around menstruation and our immune system. So it doesn't have any deleterious effects on women who have their menstrual cycle or who haven't started yet. But what's interesting, people are noticing that just like when you have a bad cold or the flu, it can mess up your menstrual cycle a little bit. It could be a couple days late, it could be a couple days early, it could be a little heavier than usual, it could be a little shorter than usual, but it's not long-standing. But it is interesting to see how our body's systems interact, and our body's basically saying, hey, I'm fighting off this really big infection right now. This is not the time to have babies. So it's, again, love science, love what we can learn.
That's great. And actually, Dr. Ashley, that's one of the best ways I've heard it really explained. So I really appreciate that. And we're going to have to quote you on that. We'll get you on the news. Well, great. That is the end of our questions. I so appreciate all of you participating, all of you who've been on and watching and posing your questions, and to our presenters. Thank you so much for sharing your words and your knowledge with us and your local community members. I think this is a time when we definitely need to ask questions and trust in those who have our best interests at heart and who are working really hard to make sure that our Vermont adolescents are safe and healthy. So thank you all. And I hope you have a wonderful Sunday, and it's the start of a new week. So enjoy the sunshine. Thank you.
Thanks so much, Stephanie. Bye, everyone.
Bye-bye.